The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
It is such a joy to live in these times. In the day that we live in, there is so much information about health that almost everywhere we go, we can see magazines or newspaper articles or books written on health that can help us to know something more about the most wonderful machinery that has ever been invented, and that is the human body. Our divine designer has designed such a complex, such a beautifully functioning apparatus that we can call this machine the most wonderful machine in all the world. The circulation is a big topic in studying about health, and we're studying about that in this program.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
About 20 years ago or more, some researchers were investigating diseases of the human body and found an association between certain diseases. This was not really new because we'd found an association with certain conditions in the body and certain diseases, such as a weakness in the respiratory tract in some people who have albinism. We have found that in people who have Down syndrome, that they may have skin problems and also may have respiratory problems and eye problems. So it was not at all unusual to find a cluster of diseases that go together. But this cluster was an unusual cluster. It was a cluster that they called Syndrome X. Now, Syndrome X is such a nice sounding name, Syndrome X. Sounds good when the doctor says it, but if you were a patient and you had Syndrome X, you might not enjoy being labeled X. So we want to discuss this cluster of disorders and see if there is some way that we can decide whether we might be more at risk of having this cluster of diseases. I call them a quintuplet of diseases. This quintuplet of diseases consists of overweight, it consists of high blood pressure, diabetes, and a special type of blood lipid problem with a high triglyceride level and a low HDL level. Now, HDL is the good kind of cholesterol and the kind that we want to have very high. Especially we want to have it above 35, and the higher it is, the better. Then there is also a glucose intolerance, which increases the likelihood that a person will get cancer. So these 5 disorders, high blood pressure, overweight, diabetes, dyslipidemia, or an alteration in the blood fats, and cancer. Now, published from a place in Italy where a number of researchers had gotten together, they studied this disorder and found that these various diseases are genetically linked. That means that if a person has one of these diseases, they're more likely to get another, and if anyone in the family has any one of these diseases, they're more likely to get another. The special type of obesity that they found was that the person had the kind of truncal obesity, not so much the obesity in the extremities. This is one thing then that we can use as a test to decide if we might have Syndrome X. High blood pressure, truncal obesity, a tendency toward diabetes, all of these things make us more susceptible to Syndrome X. Now, considering the tests that we can do at our bedsides or in our own homes to determine the presence or absence of disease, there is another one that can be done. It cannot be done by a person with their own mechanisms in the home, but they can get the services of a laboratory for a 24-hour urinary albumin excretion. I have a study here that came from Hartford some time ago, studying the excretion of albumin and its predictability for the development later of some kind of heart disease. They found in 120 middle-aged men whom they followed for that 18% of them developed cardiovascular disease if their urinary albumin was above the normal. Now, what they discovered was that in 24 hours, those people who were going to develop the high blood pressure and cardiovascular disease, that they were more likely to be very much higher in their albumin levels in the 24-hour albumin excretion. And they made this statement at the end of their testing. They said, the initial urinary albumin excretion seemed to be an efficient predictor of cardiovascular disease in this small study of middle-aged, healthy men at the beginning of the test. It says this also appears to be a predictor superior to blood pressure and serum cholesterol. So in the number of tests that we have available to us today to check on heart disease, here is another one that can be added. Now, albumin in the urine is a special subject and is amenable to testing in the home. And I'm going to get a little help in making a test of albumin. We have here a tube that has albumin in it. We know that it does because we put the albumin in it ourselves. This is egg albumin, but urine is tested in this same way. In fact, urine looks a good bit the same. Get some constant source of heat, such as a candle, and I'll get Danique Blackburn to help me here light the candle. And you will see when we heat the test tube that we get quite a cloud. Now, there will also be a good bit of smoke and smut, so that may obscure the albumin just a bit. But already I can see quite a cloud forming in the albumin that we have here. And I believe that very easily you can see this cloudy area in the test tube. Notice that if we simply rub the smut off, you can see that the tube has a very definite area of white in this place. If this were urine, we would not get this pledget of albumin that we have here, but we would get a cloudiness of the urine. And that, of course, is something that is a test that you can do in your own home. That can help you to know whether you're likely to have some kind of kidney problem. Now, some other tests that you can do in your own home, you can get a stethoscope and listen to the pulses of family members, or listen even to your own pulses. A stethoscope, such as this one, can be purchased for a very small amount of money. And Danique is going to help me here with this, and this test is done very easily. You simply take the stethoscope using the diaphragm part and listen over the carotid artery. And as I listen here, I can hear Danique's pulse very well. I listen on the other side. But I hear no other noises. If Danique had a buildup of fatty material in her arteries, I would hear some kind of noise, and the commonest one is what we call a bruit, and it simply goes like this, whoosh, It may be a whistling sound, depending on how much room the blood has to get by. It may actually be like this, or it may be a rough one, a rough sound. But if you hear any sound other than just the pulse beat from the heart, that could represent quite a problem for the patient. In fact, if the bruit is in the carotid arteries, which go here to the head, that could represent a serious problem for the person. And the person may have an impending stroke, or may be about to develop something similar to Alzheimer's disease. Not only the blood vessels in the neck, but also the blood vessel the artery that's under the arm, and the artery that is here at the elbow, and those arteries that are here at the wrist. All of these can give a bruit. I had one patient one time who had bruits in every place I listened to her arteries. In the neck, under the arms, at the armpit, at the wrist, and also the descending aorta, which is about just to the left of the spine, about right here, is a good place to listen. You can also listen to the abdominal aorta. And then where the aorta, which is the major blood vessel that comes from the heart, where it splits into the two legs, if you listen over that, you can hear a bruit in some people. Now, of course, bruits are not heard in everybody, and you hope that you will never hear them. There are certain other ways that you can test people for adequacy of their arteries, and another thing that you can do is simply to feel of the artery. Again, you do this simply by putting your fingers, and it's better to use your fingers than your thumb, because you have a large artery in your own thumb, which if you put it there, you might be confused by your own pulse. But you can feel here, and I feel, of course, a very strong beat for Danique. You can also feel right here on the inside of the arm, just on the other side of the large tendon that comes down from the biceps muscle. You can feel under the armpit, and in the same places that you listen for the bruits. If there is a reduction at all in these pulses, this can represent a serious arterial problem. While you're feeling of the pulse, you can also feel for irregularity in the pulse. Now, there are certain irregularities that are not at all troublesome to the body. They're what we might call benign irregularities or benign rhythm disturbances. The most common of these is a type of rhythm disturbance that people have all their lives. And they may not be aware of it at all until maybe they lose a little weight, or they gain a little weight, or there is a change in the health in some way, or they begin to be sleepless at night. Then they begin to recognize that they have something going on with the heart that they've never noticed before. What it feels like is that the heart has paused a moment and then made an extremely big heartbeat. That's because of the excessive filling of the heart from a little pause caused by a small extra systole or extra beat that got in, that was just sort of slipped in by the heart. And then here's the heart, has a long time to fill, so it fills big, and then makes a mighty squeeze like this, and that squeezes a large bolus of blood throughout the entire body, and the person may tell you that they feel as if the heart flopped over like a fish. And that's a good way to describe it, but it's entirely benign. It's not a problem at all. Now, irregularities in the pulse may also be slow or fast. Some of these can have great significance. If the pulse beat is fast, that may represent anemia. When the tissues aren't getting a lot of oxygen, the heart may beat much faster so that the person can get more blood. If the thyroid is excessively active, then the person may have a very high pulse rate. Or if the person has a bleeding tendency of some kind, they're bleeding from the bowel or excessive menstruation, this may cause the person to have a fast pulse rate. Now, there are some things that you can do to check your own heart to see if your heart is performing at a proper way. We call one of these the Harvard Step Test, or it may also be called the Master's Step Test. This is done very simply, and I have asked Danique and Cheryl Shears, Danique Blackburn and Cheryl Shears, to show how this is done. What is required is a step that's 9 inches high, a person with a stopwatch, and the person then steps up every other second. Okay, so Danique will show them how to do the test. And
Okay.
Cheryl, you tell her how fast to go.
Okay, are you ready? Begin. Step. 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 Step.
All
Step.
right, I'm sure you get the idea here of just how fast the person needs to step. Now immediately you will notice that Cheryl is checking the pulse. She should have the person to step every other second for 3 minutes, and then it is at that time that the person checks the pulse rate. But since we wanted to show you just how to do the test, we only did it for a few seconds. And Cheryl, what did you find?
The reading was 90. It was an excellent reading. If
Yes.
it is under 110, it is an excellent reading. If it's 110, it's very good. If the reading is 120, it's good. If it's 130, it's fair. If it's 140 or above, it's a poor reading.
Yes. And of course, by exercise and by those things that you can do with diet, this can help you to have a healthy heart and a healthy heart rate. Now, there are some things about the blood pressure that you can check at home that have good predictive value. With the two-step test, you can tell whether you're getting enough exercise or whether there might be something more serious wrong with your heart. With the step test, if the person feels uncomfortable in any way, if they have any chest pain or are excessively breathless, then you should stop the test and have them to relax, and perhaps a cool cloth on the face can make them feel better right away. Then with the blood pressure, you can get blood pressure equipment from pharmacy or from a surgical supply house very inexpensively. You should be able to get one for under $30. And there is a very nice test that was discovered maybe 30 years ago called the cold pressor test, and Cheryl is right in the process of doing that. The first thing that you do is to take the blood pressure and record it, and so get the recording of that. And what did you get, Cheryl?
100 over 70.
100 over 70. Well, that's a very good blood pressure. Now, the next thing that happens is that the person puts the hand in ice water, and you can see that this is actually ice water. It has ice floating around in it, so it will be quite cold on the hand. But the person only has to keep the hand in the ice water for 60 seconds, and so the 60 seconds are now finished, and so she takes her hand out, and immediately the examiner takes another blood pressure reading. Now, this second blood pressure reading needs to be no higher than just about 10 points above what it was when the first reading was taken. And so Cheryl is right in the process of getting this reading for us now. What did you get?
It's 110 over 75.
110 over 75. It hardly went up at all. That may be partly the stresses of being on a set with cameras. But we have this very simple test that has some predictive value for both the development of high blood pressure in the future and also the current presence of hardening of the arteries. If your blood pressure should go up more than 20 points on the systolic, that's the high reading, or more than 10 points on the low reading, that's the diastolic pressure reading, then that does have predictive value. That the more above that it is, the more likely you are to have some kind of problem develop in the future. One time when I was doing this kind of test in a public program, I had a person to put their hand in the ice water, and almost immediately the blood pressure went up 60 points. And it went up high enough that I was very glad that we could talk about this after the program and not right there on the program. So use this if the person has a serious problem with the cold pressor test. You can see how important it is that we keep the extremities always very nicely clothed. There is another test that can be easily done at home. You've probably seen it many times. When you have your hands in water for about half an hour, the more wrinkled the skin is, the more excellent your circulation, all other things being equal. If there is very little or no wrinkling of the skin when you've had your hands in water, this indicates that you have some hardening of the arteries that interrupts the communication between blood vessels and nerves in the skin. Now, another test that you can do is simply to look at people's ears. There is a crease that you can see in the ear. There are two types of creases. One is the kind of crease that you can see in my ear. This kind of crease is an hereditary crease that I have, and perhaps some people in your family may have this. There is another type, and you can see that here in this diagram on the board. You can see that this crease goes across the earlobe in this way. You will also notice that there is ear canal hair and hair along the ear in this place. Now, actually, all of these are indications of heart disease, and there are others as well. One that I would like to show you now is how the body shape is influenced by the kind of heredity that you have, and also is a predictor for whether you will have heart disease. And so Cheryl and Danique will show you that, and you see that Cheryl is measuring Danique's waist measurement. Next is a hip measurement. The waist and the hip measurements are taken so that you can divide the hip measurement into the waist measurement, and the measurement should not be more than 0.8 in a woman and 1 in a man. And so if it is more than that, then that indicates that there may be a problem in the person's heredity so far as the heart is concerned. Now, there are things that will influence the blood pressure, and I'd like to show you a number of factors. We have these that we will show you on the screen, a number of factors that influence the blood pressure test itself. So when your blood pressure is being taken, you should observe very carefully a variety of things that are involved in actually taking the test itself. One factor is exercise just before the test. If you are heavily exercising just before the test, that will influence the blood pressure. If you have emotions that are heavy emotions, that will also influence the test. And the third one is food. Heavy foods or allergens of various kinds, this can also cause the blood pressure to go up. If there is talking or noise in the room while the person is having the blood pressure taken, that will make the blood pressure go up, especially if the person themselves is talking to the person who is examining them. Then the use of drugs or tobacco that can be a significant factor. If the person smokes a cigarette just prior to getting the blood pressure taken, it can cause the blood pressure to go up. Then another one is improper technique. Now the improper techniques vary all the way from not putting the cuff on tight enough to having the stethoscope not fit on the arm in the proper place. And so any of these kinds of things can make the blood pressure be altered in some way. There are a number of herbs that can be used to increase the proper functioning of the heart. One of those is Hawthorne Berry. And you can take the Hawthorne berries themselves, which you can get at a herb store or at a health food store. They look somewhat like the rose hips that you can gather from your rose bush. But these are, as are roses, in the same family with apples. And as you know, an apple a day is beneficial for the blood pressure, and it's also beneficial for the heart. Now, I have taken some alcohol and mixed some hawthorn berries, which you should grind somewhat in the alcohol, and let it set for 3 weeks. And you get something that looks like this. Then a teaspoonful of this hawthorn berry extract, which can be called a tincture, a teaspoonful 4 times a day for about 3 weeks, and then you can drop down to 3 teaspoons a day for as long as you need to take it for the blood pressure or for the proper functioning of the heart. And it can increase the stroke volume and the efficiency of the heart, and also bring the blood pressure down. Take 1 pint of the alcohol, and be sure that is grain alcohol, or if you can't find the grain alcohol, you can use some kind of beverage alcohol, such as vodka is a very good one that can be used in this way. 1 pint of that and 4 tablespoons of the hawthorn berry powder, which you have yourself ground. And that can, of course, take a little time to do, so while you're waiting for the extract to be made, you can have the tea, which is much easier to make. Notice that these things are very simple to do. It isn't difficult to do these various tests in your own home. And they are things that can help you to know more about the kind of heart function that you have.